The device that I invented is the ViScope, the visual stethoscope, which is the first of its kind, continuous, real-time, high definition. It's a coincidence, HD, it's also a company name, but it's truly high definition sound quality, and it's a visual stethoscope. So unlike a current stethoscope where you can just see you can just hear the sounds, here you can actually see what you hear. And as you can see over here, there is a visual display which actually shows you the hard sounds, as well as if you have any murmurs that are present, it actually shows that. And the sound amplification is more than 30 times, and it can actually have the ability to detect murmurs and analyze the sounds and save them in a PC for serial studies and follow-up, and also document the report, because that's one of the biggest problems with the stethoscope. It would never give you an opportunity to document. There is no paper trail. And today in this modern evidence-based, with all the legal suits and things like that, we want to document things and compare them year after year, how the patient's abnormalities have progressed and so on. So that's where this really helps you do that. And also, it gives you the ability to transmit these sounds, because that can truly enable next-generation telemedicine as well as home healthcare applications.
And so I've been using this device now intensely for a year. I don't use anything else in auscultation. And having on-demand, real-time phono as you listen has been really extremely interesting, and I think has improved my own skills and teaching.
This looks to me to be a very elegant device, and certainly it seems to me that it will have many, many different applications, both in research, as was shown very nicely in the preceding 3 lectures, but also clinically. Specifically, I think, where I would think for my role, in my role as a teacher, teaching medical students and house staff, I think it would be very important in helping the novice time murmurs and sounds. It has been my experience that the most difficult thing many students have is to time a murmur. Just last week, making rounds with a 4th-year medical student from a very prominent West Coast medical school, she was totally, it was not ours. It was not UCSF. She had ongoing difficulty determining whether a murmur was systolic or diastolic, something very, very elementary. And something like this would be very helpful.
Over the last 20 years, I've been giving a standardized auscultation test to medical students, internal medicine residents, and fellows. I can tell you that my results and the results of other people who have done the same thing in the literature shows basically that we don't teach auscultation very well, or at least people have not learned it very well. For the medical students, their ability to detect the usual heart sounds and murmurs, about 30%. The internal medicine residents get up to 40%, and the fellows get up to 50 to 60%. There is a gradient, but it's not, the slope is very small. Anything that focuses on trying to make the physician a better physician is going to be valuable. And certainly being able to watch the photocardiogram as you listen will make it more likely that you will be focusing on what you're hearing and what the sounds that you're hearing actually mean, what they're physiologically related and pathophysiologically related to. So I think it's going to be very good for teaching.
Electronic stethoscope may improve the diagnosis of aortic stenosis and a progression of it, and decrease healthcare costs, especially in patients with mild to moderate AS, where you recommend routine follow-ups in patients with non-significant disease. Now, I work at Kaiser Redwood City, and we get these emails once every quarter on the physicians and the ordering of echo tests per 1,000 patients. And there's no financial tie-ins with this, but I think the future of cardiology with healthcare reform is that there's going to be more and more restrictions on test ordering.
No, I would like to commend you, Nelson, and your co-investigators for taking the bull by the horn, so to speak, and resurrecting the art of phonocardiography and showing how important information can be gotten out of it with relatively simple means.
Thank you. Thank you, and thank you.